And when you think about it, the body is not just a cancer. You have your mind, your body, your spirit. And traditional treatments would be give you chemo, radiation, but forget that there's a person behind it, especially with breast cancer. There's a sexuality concept, as a woman, how you
Yes.
feel about your body, right? We're
Right.
attached to our breasts.
Yes.
Did you push record?
Thank you so much for tuning back into our second act with Paige and Silka. Today is our expert segment day, and we are so happy to have Dr. Laurie Blanscet with us today. Welcome back, Dr. Laurie.
Thank you for having me.
Well, I'm always glad to have you back, and especially at such an important time of the year when all focus is, of course, on breast cancer. It is October, Breast Cancer Awareness Month, and while there is a lot of good information out there about prevention and the importance of screening, what does get lost in the fight and the battle is the living and the healing, and that's what we want to talk about today. You, of course, are an integrative physician, and one of the big movements in oncology care is integrative oncology, Dr. Laurie. Let's talk about that. What is that, and why is that so important?
And it's so wonderful that it's becoming more common. And integrative really is about bringing things together. And when you think about it, the body is not just a cancer. You have your mind, your body, your spirit. And traditional treatments would be give you chemo, radiation, but forget that there's a person behind it. So especially with breast cancer, there's a sexuality concept, as a woman,
Yes.
how you feel about your body, right?
Right.
We're attached to our breasts.
Yes.
And not only that, but just the stress. Imagine being told you have cancer. People just think the worst, and stress really affects their ability to heal.
Right. Right, exactly. Well, for our viewers listening who maybe don't understand what integrative oncology, integrative care is, how would you best describe it?
To me, the sum is, again, addressing the whole person, and it involves nutrition. It involves the mind, ways to relax the mind, get the mind focused on healing. And there's a lot of things you can do. The bottom line would be nutrition and different methods to relax the mind and the body. As well, and minimize medications.
Dr. Laurie, are you currently, or have you worked with anyone in this capacity in an integrative role with cancer treatment?
Yes, I have. In fact, I have a patient who had a recent diagnosis of breast cancer, very open to alternative medicine. And she actually goes down to Mexico because there are things we just can't do here. And I work alongside her. And she got a very low dose chemo, but we combine it with IV high dose vitamin C and glutathione, which are really powerful for the immune system and fighting cancer. She does nutritional adjustments and stress management. That was huge for her because we really feel stress kind of triggered this for her. So between the nutritional support, the low dose chemo, the mental support and everything else she's done, her tumor has actually shrunk tremendously. She's doing phenomenally. And she has done this without any surgery.
Oh, that's wonderful. That's wonderful. Yeah. What would you tell someone that comes to you that was just diagnosed with breast cancer and is beside herself and doesn't know what to do?
That's a great question. And because we don't know how we would feel unless we are in that.
Right.
So first is, give them love and realize this is a diagnosis. It's not a death sentence. And really get them to understand it does not define who they are. It's a piece of them, just like if you had a cyst to cut out, or if whatever is wrong with you, it is to identify that that's a part of them that's bad, but they have the capability to fight this.
Well, and I suppose the difference would also be at what stage it is and where they are in the process. I'm grateful that I have not had to go through it. I don't know, if I would be carrying on this conversation differently because, like you said, nobody knows what they would do unless they're going through it. I mean, can't dispense medical advice theoretically. But what I would like to ask, if possible, is what sort of, what kind of ideas can you plan to help someone make a better decision?
And that is another great question, because so many people are brainwashed into traditional medicine, chemo, radiation, and it is sad that traditional medicine does not teach complementary medicine, and it's complementary, which goes with everything else. So in educating people, I have to assess where they are. There are some people that just are not interested. So I can't even bring it up. But the people that are open, I just educate them on inflammation, educate them on nutrition, educate them on the mind, and I assess what they will do. So, for example, I love Reiki, hypnotherapy, yoga. And so I will mention these things. I will describe what they are and then see if they're open to it, and then try it. Try one. It's not going to hurt. And a lot of times people will go try it and love it.
Well, and what a lot of people, I think, don't realize unless they've gone through it with somebody else is that once you got the tumor under control, it's either surgically removed, you have radiation, you have chemotherapy, that's really when the healing begins.
And that's so true, because physically you can remove a tumor, but mentally, the trauma that people go through, there's a post-traumatic stress, just like somebody getting shot at or something, just in a different way. And it's about them rediscovering who they are, not feeling like they're going to have another cancer diagnosis, being able to relax and enjoy their body and rediscover it. So it really takes a comprehensive look, again, at counseling, Reiki, hypnotherapy, yoga, acupuncture, essential oils. These are all helpful for people. And you have to come up with a compilation of stuff that works for that person.
Dr. Laurie, one of the things that we run across that I've heard with people that I've talked with, friends of mine, when they have gone and talked to their traditional physician about seeking out alternative treatments or getting their opinions, they've been ridiculed. How do you handle that?
Yeah, it's sad. And I would say that most physicians, they mean well. And it's really in the training. So it's not to bash doctors. I understand. They really want to do their best. It's again like when they thought the world was flat when it's really round. It really comes down to that. And we're starting to realize that there's so much more. My advice to people is follow your heart, follow your gut. Yes, there are bad things out there that prey on people. I get that. But there's a lot of good alternative medicine that works for people. Research it. And if you're not getting a doctor who works with you and is willing to research with you and is open, then I would switch doctors, because I don't know everything, but I'm willing to work with people and work with other doctors who do. And that's what you want. And there is a lot of doctors out there that are open and they care and they will do that. That's what you need.
Well, the whole purpose of today's segment really is to raise awareness that there is a whole movement, out there about combining the East and the West that help treat the symptoms of the treatment of cancers and the chemotherapy, the radiation. What would you leave our viewers with on this as a point in case to consider?
That if the best thing is to prevent cancer. So for those of you who don't have cancer, please be aware of your mind, of your diet, of the chemicals that we are exposed to, because all of those things are affecting us. And if you do get a diagnosis of cancer, seek out an integrative oncologist that is open and work with somebody that's willing to help you. And if you don't have one in the area, a lot will do phone consults, and at the very least, research on your own and know that you do have options.
Well, Dr. Laurie, once again, thank you for joining us on this very important topic. We'll be linking to all of your information in the video description below. So if somebody wants to contact you directly, they can do so. We'll also have links to some very good articles about integrative oncology and encourage you, like as Dr. Laurie said, do your own research and find out what your options are. So thank you for joining us, Dr. Laurie, and we'll see you soon again on another episode of Our Second Act with Paige and Silka. Thanks for tuning in today. We hope you found this information helpful. If you'd like to get in touch with Dr. Laurie directly, I've provided her information in the video description below. And if you haven't already done so, please be sure to subscribe to our channel. The button's right over here. Thank you.